there, today we're going to do an example of a canine skin scraping. So I'll go over the supplies that we have here. So today we have mineral oil. We're going to use that to put that on our slide and our scalpel blade. We have a microscope slide, a 10 blade scalpel blade, and yeah, that's pretty much it. So we'll go ahead. The first thing we're going to start off with is you're going to want to take your microscope slide. You're going to want to put a pretty liberal amount of mineral oil on here. We'll set that aside for just a moment. The next thing you're going to want to do is you're going to want to take your scalpel blade out of its package. You're going to want to dull it a little bit before you use it on your patient. Good girl, Ari. We're just kind of lightly scraping like that. Okay, and then you're going to want to put a little bit of mineral oil on your scalpel blade here. Okay, the next thing we're going to do is we're going to find our location in which we're going to scrape. So in this case, we're going to choose this location right here. And you're going to want to pinch the skin up, and you're going to want to scrape until you get a little bit of capillary blood showing. Good girl. You're going to take what you have so far and you're going to go ahead and put it on your slide. Okay, and we'll keep going here. Good girl. Good girl. I'm so sorry, Ari. You're such a good girl. Okay, so now that we have a small amount of capillary blood, we're going to take what we have here and we're going to put the rest onto our slide. You're just going to kind of mix it in there a little bit. And you'd use this, skin scrapings are one of the things you'd use a lot for the detection of mites, among other things. So the next thing we're going to do is we're going to go ahead and we're going to take it to our microscope and we're going to evaluate it underneath the microscope. Okay, so now that you have your skin scraping all ready, we're going to go ahead and read it underneath the microscope. So first thing we want to do, we'll make sure our slide is labeled with our patient's name and dates. Okay. Okay, so we're going to go ahead and we're going to take our skin scraping. Go ahead and put it on our microscope here. We're going to go ahead and we're going to turn our microscope on. Okay, so with any skin scraping we do, you want to make sure you go in a systematic order. So you want to go kind of like a zigzag motion, sort of like that. And you do that so that way you read the entire slide, and you don't want to go over something that you've already read, but you do want to make sure you cover the entire slide. So go ahead and we'll get started. The first thing I'm doing, I'm starting on the lowest power objective, 4, just kind of the scanning lens. Okay, so I'm going to go ahead and I'm going to move up to 10. I already see lots of hair, which is a very normal thing to see during a skin scraping. And then finally I'm going to move up to 40. If you do have to clean your lens, you want to make sure that you use an optical lens cleaner that's appropriate. Okay, much better. So now that we're on 40, we're going to go ahead and we're going to scan the slide here. So again, we're going to start at the very top left corner and we're going to just go down in a zigzag. We're going to go down in a straight line, move over slightly, go back up, and then so. So we'll go ahead and read the entire slide here. And one of the biggest reasons we do skin scrapings is we're often doing them, let me focus here, we're often doing them looking for signs of mites. So one of the more common mites that you're going to see in veterinary medicine, particularly in puppies, is Demodex. So this skin scraping is actually suspicious for, that's kind of what the main thing we're looking for here. I'm actually going to move that up. Okay. So we're going to go all the way down the slide. And as soon as we reach the end of the slide, we're going to move over slightly, and then we're going to go back up this slide. And I can tell you I'm seeing a lot of hair. Now that we're at the top, we're going to move over and we're going to go back down. Lots of hair, no signs of any mites yet. Reach the bottom, we're going to move over and we're going to go back up again. Reach the top, move over, go back down again. We'll do it nice and slow. Back up again. So far, I'm not seeing any signs of mites. Oftentimes you will see mites moving, not always, but often. I'll show photos of what they're supposed to look like if we did see them. We're kind of on our last row here, so we're going to go back up slowly and make sure we don't have any signs. Any mites or anything else abnormal. I'm truly only seeing debris and hair. Okay. So we want to make sure we go back to our lowest power objective here. Take our slide off the microscope. We're going to set it aside. We'll clean up our microscope. I'm going to clean up our area, set this aside. Okay, so I'm going to show you what the kind of thing we're looking for. So this is an example of a Demodex mite. So this is a very common mite seen, particularly in puppies. Generally it presents with a patchy, basically like an alopecia patch. It's just a very, very common mite that we see, particularly in puppies. So yeah, that's kind of what a mite would look like. Because we didn't find any signs of any sort of mites or any other abnormalities, the last thing we want to do is make sure we record it in our patient chart. So the skin scraping was on ARIA, so we're going to write on ARIA's chart. We're going to say skin scraping negative for mites. Okay, and the last thing we do is we make sure somebody double checks this, so we would have a veterinarian take a look at this underneath the microscope as well, and just make sure that they didn't see any mites either. You can write, hair, debris, seen, otherwise, no abnormal findings. And then I just put my initial usually. Okay,